So in this video, I'm going to be sharing some of my Unit 4 flashcards that I made for myself just throughout listening to the lectures and going through the PowerPoints. And in my research, most of these flashcards deal with the electrolyte portion of our exam. Um, yeah, that's just how it worked out. I don't have a whole lot on the nutrition part that Mr. Napper discussed, but I did find that there's a ton of really good information in Lippincott if you search under each one of those exemplars. So I'm not the first to talk about this memory trick. I didn't come up with it, but it's good to review it. The way we remember the grading of pitting edema and how deep the pit is we double it. So a 2 plus pitting edema has a 4 millimeter pit. At what point is blood pressure too low? 90 over 60 is a good point, but the bigger factor, the bigger thing to look for and prioritize is any loss of consciousness. True or false? Most cells receive their nutrients, their gas exchange, and fluids directly from a capillary. False. Most cells receive those things from the interstitial fluid, which acts as a mediator. If we're asked on the exam about the rate of administration when we're repleting fluids or calories, we are always going to, well, I'm going to go slow. So like hours to days in repleting these things, definitely not minutes. Just a rule of thumb that I came up with. And if you don't know much about refeeding syndrome, it'd be good to know a few things about it. It's where a patient has had a big calorie deficit for a long time. So let's say only 25% of their calories for several weeks. We can't just feed them just at, at a really fast rate. We have to very, very slowly increase their calories. It's literally a critical, deadly thing to succumb to refeeding syndrome, and it's mostly going to be seen in anorexia nervosa and really long-term chronic alcohol abuse where the patient has been replacing calories with alcohol. But I think it could also be in like diabetic situations where there's like ketoacidosis, probably pancreatitis and cystic fibrosis as well. But anyway, we can actually kill a patient by feeding them too much too fast if they're malnourished. Which two common IV fluids do we not use with kidney problems? Normal saline and lactated ringers. D5W is preferred with renal insufficiency, and this would be Dr. Bogart's slide 14 as the reference point. There's something about D5W that actually helps increase the rate of renal filtration. D5W is what kind of tonicity? Isotonic. So just like normal saline of 0.9%, 5% dextrose is the standard isotonic level. So now we know that anything less than 5 or greater than 5% dextrose, like there's a 10 W, there's like 2.5 W, and then there's the dextrose plus some mineral elements, like there's dextrose plus normal saline. That's going to tell you if it's hyper or hypotonic. So a D10 is going to be hyper, a D2.5 is going to be isotonic. The thirst center of the brain is in the hypothalamus. The thirst center can be damaged by trauma, head trauma, and it can be affected in our geriatric populations. This is where older people just literally have a diminished desire to drink fluids. The lungs expel how many milliliters of water in a given day? About 300 milliliters is the standard, and this is an insensible loss that physicians sometimes will account for when they're keeping really tight INOs. The main difference between hydrostatic and osmotic forces in the fluid balance is hydrostatic forces push outside the vessel, they push from inside to the outside. Osmotic forces pull from either the in or out. Angioedema is the swelling of what tissues? The deep skin tissues, as well as some of the adipose tissues just under that. And this is where the patient looks puffy, and sometimes they can't even open their eyes. That's angioedema. Which electrolyte imbalances create an airway and a breathing risk? Low potassium, low sodium, and high magnesium. So I always associate potassium and sodium together. And one like little memory trick I use to keep those together, because they do have a inverse relationship as well, is they're both like flavor. Like you literally put salt on your food, and potassium chloride is the salt substitute that people use and we talk about so much. So anyways, back to this. Airway and breathing risk, which is a priority for us as nurses: low potassium, low sodium, high magnesium. These shifts can cause diaphragm contraction issues. And low calcium causes a shortness of breath issue. I don't necessarily think it's just the muscle of the diaphragm issue. Which electrolyte imbalances need ECG monitoring? Of course, potassium, but then magnesium, sodium, and calcium. Really out of range levels of those other threes can need ECG monitoring. Let's see, how can I remember this? Potassium and sodium, of course. Magnesium and calcium, those are all metals. So that's one way you can remember it. Cerebral edema, signs and symptoms. This is a condition that is related to some of our other exemplars and definitely to electrolyte imbalances. So let's see. It's very serious as well. Headache, neck pain, stiffness, nausea, vomiting, dizziness, irregular breathing, vision loss, memory loss, and inability to walk. And so this would be a critical set of signs and symptoms if we were to notice them. Orthostatic vital sign considerations. So I literally saw within Lippincott two kind of different ways to do this, or what they consider to be positive for orthostatic hypotension. So here's one, and that is if the systolic blood pressure decreases by 10 millimeters or more when the patient is going from lying to standing, or sitting or standing, that's positive for orthostatic hypotension. Or if there is a heart rate increase of 10 beats per minute or more when going from lying to standing. I did see a whole nother like area in Lippincott where they said 15 and 20 beats per minute. I have no idea how to reconcile that. It is what it is. Maybe it has to do with it's 10 from laying to sitting and 10 from sitting to standing. I don't know. I did the best I could. A patient experiencing acute gastritis should refrain from food for how long? Until their symptoms go away. They should only intake liquids. That's usually 20 to 48 hours.